Is the carnivore diet safe? Is it okay to do for a long time? And how do you get started? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. In this video, I'm going to give some tips and pointers and background about the carnivore diet, how to get started. I think it's reasonable to do, and things to watch out for. Be sure to listen to the end of the video where you get my final thoughts. Who would have thought that the carnivore diet would be such a big deal? It's very popular, and there's some influencers out there who have had really unbelievable and dramatic improvements in their health, and these are actually real. I've seen it in my clinic at Duke University, where I've been studying and using keto diets now for over 20 years. People come to me telling me their stories of dramatic turnaround of the medical problems, getting off medications. It's actually pretty amazing. In principle, you want to just eat animal foods. That's what the carnivore diet is. You want to avoid plants. Some people go so far as to say plants are poisonous, and well, you know, they're not immediately poisonous, especially if you've been eating them for decades and you're still alive, but that helps people stay away from those foods, thinking of them as poison. So, you know, what do you eat on a carnivore diet? Well, before we get there, if you're in medical care, if you're on medications, be careful. This diet is very powerful. It is very strong. Not that the diet may cause harm, it's that the medications that you're taking may cause harm, especially diabetes medicines, high blood pressure medicines. These have to be monitored on the first day of the diet change. So if you're taking these medicines, be sure to do this with a doctor or someone who understands how fast the carnivore diet can actually improve your health, and you have to reduce these medications. Also, if you have a salt-sensitive condition like high blood pressure, heart failure, kidney failure, you see, this is the clinical world that I live in. People watch this channel who are otherwise healthy and who also have medical issues. So I want to be careful that you're doing this in the safest way. If you have those salt-sensitive conditions, don't add salt at first. You'll want to be monitoring those other conditions. Have a blood pressure cuff at home, have a blood glucose monitor or CGM, continuous glucose monitor at home as you're getting started. So what do you eat on a carnivore diet? Well, it really can be as simple as meat. It could be red meat, it could be pork, it could be lamb, veal, it could be canned meats. Right, so actually I'm giving you a version of a carnivore diet without all of the needless, well, the over concern about the food quality and how, you know, terrible those little things are that are added to the cheese, for example. Oh, yeah, some people can have cheese, hang on. So I've been using an approach that doesn't obsess about food quality now for over 20 years, and I borrowed a system that had been worked on for 30 years before that in a clinical setting. So you want to eat foods that are animal sourced, and don't be so picky about the food quality if you don't have to be. I'll get to that in just a minute. So chicken, fish, seafood, other poultry like turkey. So basically it's meat, poultry, fish, and shellfish. And for those who tolerate it, eggs. And eggs means the yolks and the whites. It makes no sense to just eat the yolks. In fact, eggs, I think, may be the perfect food because you can actually make a whole chicken out of an egg. You know, if you think about it, you can't make a cow out of a steak. It's just the muscle of the animal. But if you eat an egg or use an egg, it can actually make an entire chicken, the entire organism. It has all of the ingredients that are needed to make that entire chicken. So the food side of this is actually pretty easy with practical pointers. Like, yes, you could have beef jerky or biltong. You could have other things like pork rinds or chicharrones. These are fine. They're animal sourced products. So you want to avoid those plant things that you see, the plant-based stuff, and just choose foods that are animal sourced. What about for preparing foods that butter? Butter is fine. not margarine, not these other oils and vegetable seed oils, although I'm not overly obsessed about those. They would be eliminated on a strict animal-based carnivore diet, but butter is fine. Now getting to, again, the reason why you're doing this, you don't want to be forcing butter if you're trying to lose the butter off your body, or the fat off your body. So if you always consider the source of the information that you're getting, and if someone's teaching you a weight loss version of a carnivore diet or keto diet that's very similar that I teach, you want to be careful about over-consuming fats and butters and even over-consuming food. So if you already started carnivore, you're stuck. It may be that you're eating too much, even in the carnivore context. So the food side of things is pretty simple. The salt is an issue in the medical world. It can raise the blood pressure. So if you have a salt-sensitive condition, you want to be careful about that. But if you're having blood pressure medicines, you want to be measuring the blood pressure at home. The medical world is worried about added salt for the blood pressure going up too much. So just monitor the problem and you're fine. In my world, I use simple things like if you're hungry, eat. So you don't have to eat 3 meals a day in the context of a carnivore diet. You don't have to push fats and macros, and that's the simplicity of using this kind of approach. It's pretty automatic when your body starts burning its own fat. Oh, right, a carnivore diet gets into the fat-burning metabolism. So a carnivore diet really is a version of a keto diet. You're getting the blood sugar reduction and the ketone burning and fat burning of a keto diet that I've been teaching people for a long time now and have learned a lot myself about. So I see the carnivore diet metabolically as a type of keto diet. In our principles, we say don't eat if you're not hungry. You know, you wouldn't drink if you're not thirsty. So, unless you have a medical condition that needs those requirements, you would always overlay the other requirements onto this way of eating. So the other things to think about are what to drink. You can drink water or sparkling water, really anything that has 0 carbs or calories on the label. Ideally you'd be eating things that don't even have labels, right? So that water would be the best thing. And yet you can have coffee and tea. These are low carb, 0 carb. Oh wait, don't those things come from plants? Oh, right. So there's some people are so obsessed about carnivore and animal and plant that they say you can't even have those things. So depending on why you're doing this, you may or may not need to be that concerned about those plant products. I'll get to that in just a minute, how strict you have to be to eliminate all plant products. I don't think everyone has to do that. So as you're getting started, a couple things to think about. You might not feel well at first. It's not the diet, it's the withdrawal from the foods and the drinks that you've had. So commit to 2 to 4 weeks, or a month, or some people say 90 days to make a commitment. I don't know, most people in my sphere feel better within a week and feel the appetite going away. So just like on a keto diet that has lots of research behind it, a carnivore diet cuts out the hunger because you're not eating those carbohydrates. The blood sugar comes down, you fix pre-diabetes and diabetes, you reverse them. You fix insulin resistance, all of these things that come with the carbohydrate reduction or carbohydrate restriction, it's called. And yet it's a problem if you've been having lots of caffeine and you drop all the caffeine, you might go through caffeine withdrawal. So if you're having a headache, cravings for sugar, that sort of thing, it's okay the first few days or maybe even a week. You're going through that withdrawal syndrome that we talk about as keto adaptation. So as your body gets used to ketones and fats and gets rid of those foods, you may go through this withdrawal and adaptation period. Most people feel fine going through this, some people don't. If you don't have a salt-sensitive condition, actually adding salt is a way to reduce or eliminate your withdrawal symptoms during that first week or 2. So then try for 2 to 4 weeks. If you're taking medications, please be careful and monitor with a doctor or a healthcare provider's oversight if you need it. I just wanted to say that there are lots of ways to be healthy. And there are many diets that have been studied. The keto diet that I've been teaching that has just a little bit of vegetable matter in it is a carnivore-ish type of diet. They're very close metabolically. So to me, a carnivore diet makes sense metabolically if you think of it as a cousin or a sibling of a brother or sister of a keto type of diet. Now, going to the carnivore level of restricting all vegetables and even dairy might actually help you get the benefits of what we look at as an elimination diet. So if you've had a problem with any of these foods and you eliminate them, you might actually get more benefit from it. Not just the carbohydrate restriction and eliminating most of the foods there. So what I see, some people get better on a keto diet, they lose their weight, but then when they cut out all of the plants, and remember, gluten is in the bread and the pasta, right? Gluten can actually cause celiac disease, and it's something that's eliminated on a keto diet. So you're getting the benefit of a gluten-free diet when you're doing a carnivore diet. Sugars can cause these problems, and artificial sweeteners and all these can be a problem. So in a carnivore diet, you're getting the benefit of all of these elimination of all of these irritants, if you will, in those foods. But not everyone has to be that strict. So when I see someone coming in and they're having difficulty doing the strict version of the carnivore diet that they taught, I explain, well, let me expand, let me give you some flexibility and have you understand the basis of why this is working. And then you may actually be able to add back foods that you tolerate well. On the other hand, if you have gluten problems and now this fixed your gluten sensitivity and your celiac disease, you actually fixed fibromyalgia and other autoimmune conditions that other doctors can't fix at all, then you may never want to introduce those foods back in. And that is a judgment that you make with a keto-friendly doctor who's not going to give you grief for eating this way. So you can see that at the one hand, this is simple. It can be very easy, but be careful when you're adding it to the clinical context of you're taking medications. Just be a little careful about adding salt if you have a salt-sensitive condition. Otherwise, I'm seeing more and more people who are getting the health benefits from the carnivore, which I see as a keto version of a diet, and the attention to which you need to pay close detail to every little carblet, every little plant, little molecule will depend on why you're doing this. If it's weight loss, if it's diabetes reversal, you won't have to be that strict. If you're trying to get rid of a autoimmune condition or trying to fix something other doctors can't fix, then you may want to pay that fine detail attention to that. Don't have the coffee and the tea. Don't have the alcohol that some people can drink alcohol on a carnivore diet. So I find that the popularity of a carnivore diet has brought many more people into this health-focused room, and that's awesome. But it's not the only way to be healthy, and if it's not something you want to do for a long time, just don't go back to that standard American diet that was not good in the first place. Try coming, part way back into eating carbs if you want to, or if you feel that it's important for family, for social living, that sort of thing. Then I hope you've gotten the benefits from dropping the carbs and eating animal products. I think that is fine metabolically. The carnivore diet makes metabolic sense. I hope you find this helpful. If you do, please click like and subscribe and ring the notification bell so you don't miss out on further content. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.